Bienvenidos todos. Welcome. I have the honor of welcoming you on behalf of the Avance Center for the Advancement of Immigrant and Refugee Health at the Milken Institute School of Public Health and our colleagues and partners, the Metropolitan Washington Council of Governments and the Regional Primary Care Coalition. We wholeheartedly welcome you to the Regional Latino Health Disparities Conference. We're all here because we're committed to addressing health disparities that impact Latino immigrant communities, and we are eager to share the strategies that we've all learned to help break down the structural barriers to Latino health equity. Before we begin, I do want to thank our sponsor, and I may be doing it again later on, but just to thank Kaiser Permanente of the Mid-Atlantic states for their generous contribution to this convening. We have a really exciting day for you. We're going to feature some advancements happening in the region around emerging research, health policies, and culturally responsive clinical care. If you notice in your packets, we have a jam-packed agenda for you. This morning, our featured speakers will be Congresswoman Lujan Grisham. She's representing New Mexico's 1st Congressional District, and Dr. Faith Mitchell, the President and CEO of Grantmakers in Health, will kick us off this morning. So it is my great pleasure to introduce our friends, colleagues, and partners who have helped put together this exceptional day. I first will introduce Chuck Bean, who is the an executive and civic leader with over 20 years of leadership experience in nonprofits, philanthropy, and government. He is currently the executive director of the Metropolitan Washington Council of Governments, one of the country's most prominent regional councils where he is responsible for its overall administration. I will mention that all of our presenters and speakers and guests have amazing bios. I do ask you to please go into your agenda and your packets and read them. We don't have time to acknowledge all of their wonderful accomplishments, so we ask you to do that. I will then say that our next speaker after Chuck, who will welcome you, is Sharon Zalewski. She's the Executive Director of the Regional Primary Care Coalition, serving the District of Columbia, Northern Virginia, and suburban Maryland. She's held leadership positions in a number of organizations focused on improving the health of vulnerable residents throughout the region, including Healthy Montgomery, the District of Columbia Primary Care Association, and a number of others. And then finally, at the end of our welcoming panel, Dr. Mark Edberg, who is Center Director and Co-Investigator for the Center's Research Corps for the Avance Center. He is an Associate Professor in the Department of Prevention and Community Health. He is an applied and academic anthropologist with more than 20 years' experience in social research, primarily in public health. So again, on behalf of our partners and colleagues, I welcome you, and now we turn it to Chuck. Thank you. You're very welcome.
Buenos días.
Buenos días.
Buenos días, amigos y colegas de la región. Soy Chuck Bean, me llaman también Carlos Frijoles. En el nombre del Consejo de Gobiernos de la Región Metropolitana de Washington, o COG, les damos las gracias por acompañarnos hoy. Para aquellos que no están familiarizados con nosotros, COG es una asociación independiente que reúne líderes de nuestra área para abordar los principales problemas regionales en el Distrito de Columbia y los suburbios de Maryland y Virginia. Estamos muy contentos hoy para reunir a algunos de los líderes de la región electos, funcionarios de la salud pública, profesionales sanitarios, investigadores y fundaciones de apoyo, para hacer frente al desafío grave de disparidades de salud en la región metropolitana de Washington. La conferencia coincide con el mes de herencia hispana, ya que reconocemos y celebramos esta comunidad. Con esto me gustaría reconocer a algunos de nuestros socios muy distinguidos. En primer lugar, me gustaría presentar a los líderes locales que trabajaron con el Consejo de Gobiernos y nos aconsejaron en el evento de hoy. Por favor, demos la bienvenida a la honorable Nancy Navarro, concejal del Consejo de Condado de Montgomery. Y Walter Tejada, Jackie Reyes va a venir muy pronto. También quiero reconocer nuestras agencias asociadas que ayudaron a organizar este evento. George Washington University Avance Center, and the Regional Primary Care Coalition. Asociaciones como estas que ayudan COG y líderes locales hacen un mayor impacto en la región. Desde la promulgación de Affordable Care Act, hemos sido testigos de un cambio significativo en la forma en que proporcionamos atención a una de las comunidades de más rápido crecimiento en la región y en la nación. El acceso a la asistencia sanitaria es un tema especialmente importante en la comunidad latina porque las barreras como el idioma, una barrera que los hablantes de inglés están experimentando mientras hablo ahorita, impiden a tantas personas de obtener la atención que necesitan. The conference is going to be in English today, but Chuck's here making a point about one of the barriers, and that is language. Gracias. Esta conferencia es una oportunidad para todos nosotros de aprender de lo que está haciendo para abordar las disparidades de salud y las formas en las que podemos trabajar juntos para romper las barreras a health equity. Una de las maneras en que el Consejo de Gobiernos espera ayudar a unificar la región en el tema es nuestro nuevo Regional Healthcare and Community Resources Directory que ustedes han recibido o recibirán hoy. Y gracias a todos por su participación. Ahora, permítame presentarles Sharon Zalewski, the Executive Director of the Regional Primary Care Coalition, y invitarla a saludarles. Gracias.
What's he doing?
Okay, thank you very much, Chuck. Well, good morning, everybody. Thank you for coming. I want to talk a little bit about the Regional Primary Care Coalition. Established in 2001, the Regional Primary Care Coalition is a collaboration between the local philanthropic community and the local primary care associations, which represent about 40 safety net primary health care providers. And RPCC is committed to improving access to quality care, reducing health disparities, and advancing health equity. And the Metropolitan Washington region is interesting. It includes 2 states and the district, which is almost a state. And I'd like to get a sense of where folks are from today. How many people here are from Maryland? Yes, very good, thank you. How many people here are from Virginia? Oh, very good, thank you. And how many people here are from the state of New Columbia? Very good, thank you. So we see that despite the boundaries, our borders are porous, and we live, work, play, pray beyond our jurisdictional boundaries. And despite state and local jurisdictions, state and jurisdictional differences, there are striking similarities and underlying factors associated with health disparities experienced by Latinos and other immigrants, including the affordability of health coverage, access to culturally competent, person-centered health care, comprehensive community-oriented health care networks. There are financial, social, educational, and environmental challenges that are common among resource-poor communities. So compared to other parts of the country, this is a very well-resourced community. It's a very wealthy community. Yet we have significant and persistent health disparities based on inequities in race, income, opportunities, and immigration status. If we align our resources, establish common goals, we can develop a common agenda to address inequity and reduce healthcare disparities in this region. I hope that today's forum will strengthen collaborative efforts to advance health equity. I am pleased to be here today collaborating with the Metropolitan Washington Council of Governments and the Avance Center for the Advancement of Immigrant and Refugee Health to provide a regional learning opportunity. I am now pleased to introduce my colleague, Mark Edberg, Director of the Avance Center. Thank you.
Ok, gracias otra vez y bienvenidos. Voy a hablar un poquito sobre las actividades del centro Avance, que está financiado por el Instituto Nacional de la Salud. So I'm going to be talking just a little bit, give you an update about some of the activities of the center. I will try to be brief. People who know me know that that's kind of an oxymoron to say that, but I will do my best. Okay, so if most of you probably already know this, but a P20 center is it's an exploratory research center, and P20 centers are supposed to collaborate with communities, supposed to build capacity, engage the community, and help the community engage in its own prevention, and conduct exploratory research on factors leading to health disparities. And so it's a relationship. It's not just a project. The center is a relationship with a community or several communities. And the way we address these, we have a collaboration right now with the community of Langley Park in Maryland. That is we are focusing right now on the Latino immigrant community. We have a project called ADELANTE, and this is a community intervention that is focusing on the prevention of substance abuse, sex risk, and violence among Latino immigrant youth. And then we have a whole host of activities that are promoting engagement of the community. So there's lots of social media. We have a media campaign that's just rolling out, which I'll talk about very briefly. We've had some development of YouTube, web novellas, and all kinds of things like that. And then we also engage in capacity building, so bringing students down to work in the community and at least beginning the process of trying to connect with organizations in the community to help build their capacity. And then it's very important, we hope that the center serves as a platform for building on the activities we do in order to grow those kinds of activities. And one example is that building on what we've done, we recently received about a year ago a grant from the Centers for Disease Control, the REACH grant, which is focusing on poor nutrition in the community. So now we're able to address two sort of areas of health disparities. Just wanted to give the shout out. There are many people to give a shout out about in the center and our community partners. The center is divided into cores, that's areas of activity. Dr. Elizabeth Andrade, who's somewhere here, she's over there. Mm-hmm. She is the head of our administrative core. That really manages the relationship. Dr. Cleary, Sean Cleary. Sean will be here. He heads our research and intervention core and is co-director for the center. Dr. Karen McDonald, she heads our training and education core, and that is the core responsible for this conference, as well as many other capacity building activities and education activities in the community. Dr. Doug Evans, who, I don't know if Doug's here, he is head of the community engagement core, so a lot of the social media and media campaign activities are under that core. And Dr. Rajiv Ramal, he's the head of the Department of Prevention and Community Health, where the center is focused. Our key partner, and we've been working with this partner for a long time, and we truly appreciate their massive efforts, because it really is a lot of work, is the Maryland Multicultural Youth Center, which is a division of the Latin American Youth Center, a long-time partner in the community. The director of MMYC is Luisa Montero. Rosa or Delmi Alvallero is the director of the Adelante program. And Angela Gonzalez she manages a lot of the programs of Adelante. And then there are a host of case managers and other staff that really do a great job. For the Rivera Group, which is instrumental in helping with our research and community engagement, Yvonne Rivera is the director. And then we have lots of other partners. We work with the Prince George's County Transforming Neighborhoods Initiative, with schools, with organizations like Casa de Maryland and Mary Center and others in this endeavor. So there are a lot of people. It truly is one of those village enterprises, so to speak. Okay, now there's gonna be two slides here which are totally complicated and probably unintelligible in a certain way, but I'm just gonna put them up there so you get a general idea for the ADELANTE program and what we're trying to do. It's a positive youth development effort. So the idea is that prevention is based on building capacities, building strengths, building assets, and building a stronger community, as well as building pathways to success, and that is the mechanism for improving health and prevention. So this is just shows you on the left, there's a list of activities that we do, which include individual capacity building and also working to develop community activities and community connections. On the right, those the theory is that those lead toward the prevention of these kinds of health disparities. Here's another way to look at it. It's just kind of a flow going that way. And on the top of the model with the circles, you see our community partners, because we have more recently began to develop a community advisory board which integrates with our projects and helps create some of those pathways to success. Just to give you a clue that, or just a little hint about the way the community has rapidly changed, even in the time that we've been there. When we say cohort here, there's a group of parents and youth who are part of a sort of a specialized series of activities that we do in the community. And just to see the difference between the first cohort and the second cohort gives you a real indication about how the community has changed and how that inflow of people recently fleeing from violence in Central America has impacted our community. So you can see that in the first cohort, about 36% were U.S. born, and in the second cohort, only 21%. So it's a fairly dramatic change in the nature of the community. Just a few selected accomplishments. We've served about 250 youth, and that's an unduplicated count, so it's approximately, through multiple program activities, the kinds of capacity building work that we're talking about. This does not count the broader community activities, the soccer, the fairs, the tutoring, and other things that we do in the community. So this is just in very specific kinds of activities. We have now collected, because we have to collect evidence on whether or not the program works. We have our intervention community, Langley Park, and we have a comparison community in Virginia. We've collected baseline data, and our first set of follow-up data. We're beginning analysis to, again, collect the evidence to see whether or not the program works. We've also been collecting data from these cohorts, this sort of subgroup of parent and youth dyads that receive some specialized services. Just a few little factoids. Some of the programs that we've already collected data on have shown some very impressive gains in prevention knowledge and capabilities, school success skills, things like that. The things that fortify people and enable them to be more resilient in the face of health threats. We've developed a number of innovative education strategies, including a series of web novellas, the Victor and Erica series. Anybody here ever seen that? Victor and Erica? If you have not, go just YouTube Victor and Erica Langley Park, and you'll get 6 series of web novellas. You have to start with the first one, though. There are 6 of them. And we've got a media campaign that's just rolling out. And then we've now conducted one symposium, and this is our second annual conference. There has been student research conducted in the community, and we have a new course which will be offered fairly soon on immigrant health disparities. We have developed a community advisory board. It is working with both our ADELANTE and our REACH projects. The REACH projects, as I mentioned, is recently funded by CDC. That is focusing on poor nutrition in the community. That's a participatory project. There are now signed MOUs with 8, and it may be approaching 10 organizations in the community now, including the Prince George's County Health Department, to participate in that. And then as part of the formative process in developing how that program was going to address poor nutrition, we've engaged the Community Advisory Board. We've had a youth advocacy component and all kinds of other activities to do that. And the focus will be on promoting water for drinking as opposed to sugar beverages, which is a big issue that contributes to obesity and diabetes. So just a few photos. These are some from some of our innovative media and engagement campaigns. That on the right up there is a shot from Victor and Erica. You can see our logo, which was developed by youth. And that's on T-shirts and all sorts of other things in the community now. These are some samples of our media campaign ads that and what the campaign is doing is in a sense branding the ADELANTE intervention in terms of what it represents. And we took a long time in trying to work with the community to understand what the ADELANTE intervention should represent, and that's what's coming out. So you can see that ADELANTE represents strength here. ADELANTE represents, pride, and I'm in being Latino. It represents dreams. It represents responsibility, and represents also connection with the community. All these themes are part of these ads, which are going out in social media. There'll be bus ads and a range of other ways that we're doing that. Just a real quick slide showing the REACH program already in the space of a year has developed this coalition, which includes a lot of organizations in Langley Park and the surrounding areas. Then here's our contact information, which you already know. And here's our shot of our kids. So we have to have that. These are our kids. So thank you very much. And, again, I encourage you for more information. There are lots of sessions. There are sessions on the specifics of ADELANTE, REACH, and many of the other activities. So welcome and enjoy the day.
Thank you, everyone. Well, we're really going to have a full room, and it's exciting to see you. In my excitement to kick off the day, I forgot to tell you who I was. So I am Olga Acosta-Price. I am an associate professor here in the School of Public Health and in the Department of Prevention and Community Health. I also am the director of another center here called the Center for Health and Healthcare in Schools, and am a part of the Avance Center and the Training Corps.